Hello and welcome to today's consortium call focused on the National Academies of Science, Engineering, and Medicine report, which is titled Parenting Matters, Supporting Parents of Children Ages 0 to 8. My name is McPherran Lombardi and I'm from the University of Connecticut. I'm hosting today's call along with Patricia Barton from SRCD. Patricia is going to start by providing technical support throughout the webinar, and she'll just spend 1 minute now orienting you to GoToWebinar.
Good afternoon, everyone, and welcome to today's consortium webinar. Before I begin today's webinar, I want to say a few words about the consortium and about using GoToWebinar. The University-Based Child and Family Policy Consortium is a network of more than 25 university-based institutions, including centers, schools, departments, and programs that have an interest in child and family policy. We are organized around three main purposes. First, to share the latest findings and strategies for conducting policy-relevant research to facilitate collaboration across our member institutions. Second, to encourage cross-disciplinary undergraduate and graduate training to support the next generation of child and family policy researchers. And third, to foster effective translation between research, practice, and policy audiences. The consortium is run in collaboration with the Society for Research in Child Development and hosts a number of webinars each year on a variety of topics. If you are interested in learning more about the consortium, having your institution join the consortium, or if you would like to join our listserv, please see the information on this slide. Just a quick word before we begin about the technology we are using today. We are using GoToWebinar to host this webinar. All of the attendees are muted. If you have questions for the speakers, please use the question box on your screen to submit them. All of you should be able to hear the presentation and see the slides on your computer right now. You can choose to listen to this webinar using your computer audio or by calling in. Today's webinar will be recorded and will be available on the consortium website and on SRCD's YouTube channel. I will send a link to the recorded webinar, the slides from today's presentation, and additional resources related to this report around to all participants following the call. And now I'll turn things back over to Caitlin to introduce our topic and our speakers.
Thank you, Patricia. And now it's my pleasure to introduce the topic and speakers. The National Academies of Science, Engineering, and Medicine recently released this report, which is informing a national framework for strengthening the capacity of parents of young children ages birth to age 8. This report's intended to serve as a roadmap for the future of parenting and family support policies, practices, and research in the United States. On today's webinar, we have three members of the study committee that authored this report: Dr. Eric Deering, Dr. Natasha Cabrera, and Dr. Kimberly Boller, and they will be discussing the report's conclusions and recommendations. I'm going to start by introducing all the speakers now. So first, we'll have Dr. Eric Deering, who will start the presentation. He's a professor of applied developmental and educational psychology at Boston College's Lynch School of Education. His research examines the roles of family, childcare, school, and community for promoting the development of children growing up facing economic and social disadvantages. Next, we'll be hearing from Dr. Natasha Cabrera, who is a professor in the Department of Human Development and Quantitative Methodology in the College of Education at the University of Maryland, College Park. Dr. Cabrera's research focuses on father involvement, ethnic and cultural variations in fathering and mothering behaviors, and family processes in a social and cultural context. Our concluding speaker will be Dr. Kimberly Boller. She is a senior fellow for Mathematica Policy Research and directs multiple research programs focused on young children in both the United States and abroad. First, we'll start with an introduction to the report from Dr. Deering. Welcome, Dr. Deering.
Thank you, Caitlin, and welcome to all of the attendees. I'm delighted, along with my colleagues, Dr. Kimberly Boller and Dr. Natasha Cabrera, to be sharing the results of a report that we were part of the committee that prepared, Parenting Matters, Supporting Parents of Children Ages 0 to 8, which was prepared for the National Academies of Sciences, Engineering, and Medicine. Before we dig into the heart of the report, though, many attendees may find it useful to get a little history and background of the process for the National Academies. So the National Academy of Sciences was established by Congress over a century ago, and in fact under President Abraham Lincoln. and it was established to provide scientific and technological advice to the nation. It's recently been expanded to the National Academies of Sciences, Engineering, and Medicine, collectively known as the National Academies. So when you hear me or Natasha or Kimberly say the National Academies, this is what we're referring to. And one of the ways that the National Academies provides advice to the nation is through written reports, and this is an example of one of those reports that we'll be talking about today. It reflects a consensus reached by an expert study committee, and that this is an important point, that we won't be offering you Eric Deering's opinions or Natasha Cabrera's opinions or Kimberly Boller's opinions, but really a consensus that we've reached as a study committee. In general, these committees include between 10 and 20 members, and they come from a diverse range of areas of expertise on the topic and with diverse perspectives on the topic as well. And the reports originate from the request of outside sponsors such as Congress, federal agencies, and foundations, and that this was certainly the case for our report, which we'll get to a slide in just a little bit showing you who the outside sponsors were. But the outside sponsors came to us with a request for a report on how parents of young children can be supporting their development. And they gave us a very specific statement of task. And so the process for these reports is guided by a statement of task, which is a formal set of questions that are to be addressed by the study. And I'll also show you what our statement of task was and give you specific background on what we're trying to address in this report. It's also important to recognize that after the committee finished a drafted report, that went under independent review from anonymous experts that were not on the committee, and then the report was revised to meet any kind of feedback, additional information that was requested. And just a piece of information as well in terms of how does the committee arrive at consensus. In addition to the knowledge bases that are being brought into the committee by each of the experts, we also rely on commissioned papers from other experts in the field, as well as literature reviews that are conducted by Academy staff. So the National Academies has an amazing research staff that supports the development of these reports. And we also, in this case, we're directly examining the different clearinghouses for parenting interventions that are out there. So some may be familiar, for example, with the WhatWorks clearinghouse. And so this is a kind of a multi-pronged information gathering process in developing one of these reports as well. So Patricia, we can go to the next slide. Thanks. So here are the study sponsors that developed the statement of task for this report. As you can see, it's a mix of federal agencies, for example, Administration for Children and Families, as well as foundations, including the Bezos Family Foundation, Bill and Melinda Gates Foundation, and several other centers and foundations as well. So Patricia, you can go and go to the next slide. And I should also, before we get going too much further, acknowledge who the committee members were here for the Supporting Parents of Young Children Committee. The chair was Vivian Gadsden, and then the other piece that I'd like to draw attention to is that the committee members are coming not only from psychology and human development fields, but also with expertise in policy as well as public health. We had experts in pediatric medicine, as well as experts in family practice and economics. So a wide, diverse array of areas of expertise concerned with parenting of young children were represented here on the committee. Okay, Patricia, I think great. Thanks. So here's the statement of task. So this is what guided what you will find in the report and what you'll hear from us today. There was a 5-point statement of task. The first being to identify parenting knowledge, attitudes, and practices that support positive parent-child interactions and healthy development of children ages 0 to 8. Now we informally refer to, and so you might hear and you would see in the report the term CAPS, parenting CAPS, so K for knowledge, A for attitudes, and P for practices, that we were tasked to identify parenting CAPS that support positive parent-child interactions and healthy development. We were also tasked to describe strategies that have been found to be effective for supporting parents and helping them carry out parenting practices associated with healthy child development. and to identify barriers and facilitators to strengthening parenting capacity and parents' participation and retention in effective programs and services. The fourth piece of the statement task was to identify areas for future research to strengthen the evidence and strategies for supporting parents. And finally, we were asked to make recommendations to promote the wide-scale adoption of effective strategies across public and private sectors into health, human services, and education systems. And again, I'll just underscore that this statement of task came to the committee. The committee did not develop the statement of task. We responded to the statement of task. And it's just for historical note purposes useful to recognize that this statement of task was developed from the agencies named in the prior slide and those foundations during the Obama administration. And to a large extent, those agencies were aiming to leave a legacy in this domain, this of supporting of parents of young children domain. So I think we go to the next slide, Patricia. Great, and I'll turn it over to Dr. Natasha Cabrera now.
Great. Good morning, everyone, and welcome to the webinar. As Dr. Mir Deering noted, the first part of the committee's task, please next slide, was to identify parenting knowledge, attitudes, and practices, the CAPs, that promote positive outcomes in children ages birth to 8. The committee focused on identifying CAPs that influence the following domains of child development: physical health and safety, emotional and behavioral competence, social competence, and cognitive competence. The committee further defined knowledge as parents' basic understanding of infant and child developmental milestones and norms, and the types of parenting practices that promote children's achievement of these milestones. With respect to how knowledge influences parenting, the extant research, which is largely correlational, suggests that parents with greater knowledge of child development are more likely to have quality interactions with the children and engage in practices that promote the children's healthy development. Moreover, and perhaps not surprisingly, evidence suggests that parents who have knowledge of evidence-based parenting practices, especially those related to promoting children's physical health and safety, are more likely to use these practices than parents who are not. These findings indicate that parents can benefit from having clear and specific information on child development and evidence-based parenting practices. Next slide, please. In terms of attitudes, parents' attitudes towards parenting are a product of their knowledge of parenting and the values and goals or expectations that parents have for the children's development, which in turn are informed by cultural, social, and societal images, as well as parents' experiences and their overall values and goals. In the area of parenting attitudes, the committee found that available research does not allow for the identification of attitudes consistently associated with positive child outcomes. Nevertheless, parents' attitudes and beliefs, such as about the roles of parents and others in the raising of young children, or about specific parenting practices, for example, the role of parents in children's education, may contribute to some variation in practices and in uptake of services among individuals and subpopulations. These findings indicate a need to take parents' and attitudes and beliefs into consideration in the design and implementation of programs and services. Next slide, please. Parenting practices the committee found to be associated with positive child outcomes in the areas of physical health and safety, emotional, behavioral, social, and cognitive competence include contingent responsiveness, also termed serve and return. This is adult behavior such as smiling at a child or asking WH questions that occurs immediately after a child's behavior and that is often related to the child's focus of attention. Also showing warmth and sensitivity toward children, having routines such as bedtime or meal times, and reducing household chaos such as too much noise or disorganization, engaging in shared book reading and talking with children, engaging in practices that promote children's health and safety, in particular receipt of prenatal care, breastfeeding, vaccination, ensuring children's adequate nutrition and physical activity, monitoring, and household vehicle safety. And lastly, using appropriate and less harsh discipline. Next slide, please. Turning on to the second part of the committee's charge, to identify strategies that strengthen parenting capacity and promote parenting practices associated with positive child outcomes. The committee's report describes a number of interventions that support the parenting practices listed in the previous slide, as well as the well-being of parents themselves. And these include formal sources of parenting support, such as well child care and center-based child care, parent skills training programs such as home visiting programs that address positive parenting practices, family economic self-sufficiency, child health, child development and school readiness, and reduction in child maltreatment, as well as two-generation programs and parent engagement in school settings and interventions targeted to parents facing adversities such as mental health, mental illness and poverty, earned income tax credits, a temporary assistance for needy families, and special supplemental nutrition programs for women and infants and children. However, we know that many parents who could benefit from these interventions do not receive them. And now I turn to my colleague, Kimberly Boller, who will take you through the next part of the report.
Thank you, Natasha, and good morning, everyone. I wanted to start by saying that the committee really organized the report around this issue of universal and preventive and widely used interventions as we describe them in the report when you have a chance, if you haven't taken a look at it yet, and the targeted interventions that support parents of children with special needs, those facing adversities, and parents involved in the child welfare system. So when you look at the two chapters, the pretty long, substantial chapters that go over those interventions, that's how they're organized. And then we have the elements of effective parenting interventions, a national framework that we lay out there, the sort of platforms that exist, and then the conclusions and recommendations. So we're just sort of laying out here the recommendations pieces as we're jumping into our discussion, but I just wanted to give you the little overview of how that's laid out. And this first recommendation and a number of the recommendations call for the formation of committees at the state and local level and recommendations for what they might oversee. And this set is about scaling effective interventions. And that really is a big issue. The committee had a concern about once you know what might be effective in these areas, how do you bring them to scale locally? So to address these kinds of challenges, the charge here, and this is kind of the fun part that the committee gets to do, is to say, okay, you, Department of Health and Human Services, Department of Education, state and local agencies, community-based organizations, those who are implementing services that get to families, go ahead and really think about, identify strategies at the point of service delivery to put these evidence-based strategies into effect for the families that need them, how to get those into their hands, how to get referrals in place for families that need these types of resources so that they can get what they need. Next slide, please. So when we think about that, though, the committee still was saying that you need to do the kinds of research to understand what works as far as the models that have been identified that get to the right users. How do we know what is needed to bring the effective parenting programs to scale, how to better enable communities to learn about them, which ones are the right ones for their communities, assess the fit to family needs and community needs, develop the needed adaptations, and monitor fidelity. So that is another part of the recommendation here to get families what they need and scale them effectively. Next slide, please. Recommendation 2 in this area of scaling effective interventions really is about this question of the public-private coordination to fund research focused on developing guidance for policymakers and program administrators, how to scale as widely and rapidly as possible. This includes information on cost, development of measurement toolkits, and implementation guidelines. So for example, coordination could occur between government agencies such as the Department of Health and Human Services, Department of Education, and the philanthropic funders of the report. Next slide, please. Another set of the recommendations really focus on the workforce, and I wanted to point out too that a previous NAS report, Academy of Sciences report, focused on the early childhood workforce, and that's another thing for us to think about is the coordination across these committee reports. That came up at the Society for Research SRCD's pre-conference on this report, and Natasha and Eric can talk a little bit too about and federal folks can talk about that as well. There was a federal panel. Some of you might have been able to go to that too. We can talk about that as well. Some of the recommendations there did talk about how do we think about across these different reports and what the takeaways are across them that might yield further sort of synergies about what we could do in early childhood. So our report, thinking about the workforce and the ability to get these evidence-based interventions to communities, included recommendations for the Department of Health and Human Services to promote these parenting interventions, to operationalize the common elements of the parenting interventions, compare the benefit of these interventions, and really think about developing common terminology, say across early childhood education, pediatric settings, the technology area, which again, when we think about silos, for example, and how they've developed in our in these different fields, we need to be able to talk to each other. We need to be able to think about development of open source curricula. Many of the models that we have, say in home visiting, are branded. You have to buy them before you even know what's in them, for example. So open source curricula might be useful in these areas. Things like the creation of incentives and training programs so that we have a workforce that's able to work across different areas, for example. Cross-training would be useful. Next slide, please. One of the things that we're faced with a lot in these areas is the question of engagement of parents in the programs and services. For example, getting families to take up the services that are offered. Often, for example, in some programs, only 40 to 60% of things like home visits are actually taken up by families. The question is, and this recommendation focuses on, for example, the Department of Health and Human Services, Department of Education, putting a group together and really working on the question of reviewing and improving professional development for those who work with families across different sectors to think about how to engage parents in this question of parent engagement, so that we're not just working with parents, not doing to parents, for example. So how do we really get beyond talking about engagement and developing frameworks, developing models that really are about parent engagement and strengthening the research in these areas, for example. So recommendation number 4 is about putting together ways of thinking about this and, again, engaging parents in this. And recommendation number 5 is about a toolbox, developing a toolbox of evidence-informed engagement activities, working on joint decision-making models, and again, putting those things in place across our different sectors, not just in one sector. Next, please. Recommendation number 6 is really thinking about the Department of Health and Human Services, Department of Education, and communicating evidence-based information to parents. This is a different kind of a recommendation. This is about getting parents through perhaps parent wide-scale communications efforts, public service campaigns, for example, about developmental milestones for children, so that parents are aware and are able to understand those milestones better and be able to know when children have issues in their development, and perhaps be able to seek help, special services, and to make sure that that information gets to different parents with children who may be at risk for not meeting those milestones, and making sure that positive parenting practices, what those look like, really are available to parents, and that can draw on the latest science and information. So those are a brief overview of the first 6 recommendations from the committee's report. And let me pass it on to Natasha now to go on with additional recommendations. Thanks, Natasha.
Great, thank you, Kim. That was great. So to continue, I'm going to walk you through some of the gaps and recommendations related to research. As Eric noted at the beginning of the webinar, the committee has spent a majority or a good chunk of their time together poring over the evidence, trying to understand what we knew about what and where were the gaps. So the following recommendations are really based on that effort, like collective effort to come to grips with understanding where do we take the science next. So also, as Kim noted, some of these recommendations are really specific to some of the agencies that requested the report. So recommendation 7 that you have in your slide is specifically for the Secretary of the U.S. Department of Health and Human Services and the Secretary of the U.S. Department of Education to launch a national effort to address major gaps in the research base around to practice, from research to practice and practice to research on child development related to parenting. So we had some specific goals for this effort. One is to conduct a systematic review of the evidence for selected areas. As we noted earlier, we know a lot more about how knowledge have an impact on parenting than we know, for example, about beliefs or attitudes. So that would be a good area to focus. The next is to further development and testing of the most promising interventions for specific groups. We also talked about research on newly developed and existing interventions conducted through innovation networks, and then conducting rigorous efficacy, effectiveness, and implementation studies or promising programs and policies that can be conducted with different populations. In funding decisions, we also the committee recommended that priority should be given to examining interventions delivered in the context of services that reach large numbers of families. For example, prenatal care, well child care, Head Start and early Head Start, and parent engagement in the early grades. Next slide, please. The committee also identified 3 important areas of need for additional research as described in the recommendations 8, 9, and 10, all of which address populations of parents on which relatively little evidence-based research has been conducted and for which few evidence-based interventions have been developed. This is an important recommendation because it acknowledges the families today are perhaps different in configuration and makeup than they were 10, 15 years ago. Some of these interventions were being designed. These recommendations are aimed at improving the evidence on the following groups. Interventions for parents with special needs, for example, mental illness or substance abuse. Interventions that engage fathers, which is close to my heart. There are very few interventions that include both parents, and so it would be really important to have interventions that address the needs of how mom and dad relate to the child, not just one parent. Differences in parenting and engagement in interventions across diverse populations and family forms. Again, taking account that families today look very different from what they were perhaps 10, 15 years ago. With respect to parents with special needs, the committee found that relatively little is known about how best to support parents with special needs. Research is needed to realize the potential of available interventions that show promise for these parents, several of which are described in the report, as well as to develop new interventions that reflect emerging knowledge on how to support these parents with the children. With respect to research on fathers, the committee found that fathers are underrepresented in research on parenting in general and parenting support, and specifically in parenting interventions. Very few interventions that aim at improving the mother-child relationship also target the father-child relationships. We think this is an urgent focus for that, for these interventions. Last, the committee's recommendation for research on diverse family forms arose out of committee findings that we know little about whether and how differences in parenting that have been observed across subpopulations matter for children's development. We know little about how engagement with, acceptance of, retention in, and the efficacy of interventions for parents vary across culturally and linguistically diverse subgroups. And the data are lacking on how parenting, engagement interventions and services, and efficacy of services may vary for diverse family forms, for example, same-sex parents. Kinship providers, such as grandparents, step-parents, and other adults assuming parental roles, for example, foster or adoptive parents, despite increasing diversity in family structure. The committee believes that filling these gaps in research would improve the ability of evidence-based programs and policies to support the needs of a range of families and children while addressing the needs of parents from historically marginalized and underrepresented populations. Further, the committee recommends recommendation 8, specifically again to the U.S. Department of Health and Human Services and the U.S. Department of Education, in coordination with private philanthropists, should fund research aimed at evaluating existing interventions that have shown promise and designing and evaluating new interventions for parents with special needs. The design of new interventions should be informed, by elements of successful programs, which include treating parents as equal partners, tailoring interventions to meet families' needs, making programs culturally relevant, ensuring service integration and collaboration for families with multiple needs, providing opportunities for peer support, addressing trauma, and targeting both mothers and fathers. Funders should incentivize the use of state and local data to support this research. With that, I turn to my colleague Eric, who will get you through the rest of the report.
Great, thanks Natasha. So I'm going to pick up with the 9th recommendation here, and although let me just take a little moment on the side here to say that if you have questions for Natasha, Kim, and I, there is a questions box in the interface for the webinar that you can type those questions into. We do have several that we got prior from many folks, but if you have a question, feel free to add it to that list and we'll try to get to as many as we can. So, but picking up with the recommendations again, the 9th recommendation is focused primarily on the co-parenting and fathering in terms of the knowledge gap that Natasha mentioned earlier in those domains, co-parenting and fathering. And we make a recommendation to the listed agencies and philanthropies and foundations that they should increase support for studies that can inform the development and improvement of parenting interventions focused on building parents' capacities to parent both individually and together. And that studies should be designed to identify strategies that can improve fathers' knowledge and use of parenting practices associated with positive outcomes, and should examine the unique and combined effects of individual and co-parenting practices, again focusing on that lack of knowledge we have on fathers and on co-parenting, with special attention to building strong relationships between parents and within diverse parenting relationships. As part of that, we also, I'll just draw your attention to this other piece that's bolded here, that these should be designed to shed light on the specific ways, these studies should be designed to shed light on the specific ways in which greater investments in co-parenting can lead to better outcomes for children. Okay, next slide, please. So for recommendation 10 now, this is following from, as Natasha mentioned, the lack of cumulative knowledge that we have on diverse populations, as well as several understudied groups when it comes to understanding parenting that supports young children. And so we also recommended as a committee that U.S. Department of Health and Human Services and the U.S. Department of Education launch a multi-pronged effort to support basic research on parenting and applied research on parenting interventions across diverse populations and diverse family forms. And that research should include identification of, first, key constructs and measures related to successful parenting among different populations, but it should also include identify important gaps in knowledge of how parenting practices and parent-child interactions affect child outcomes in culturally, ethnically, and socially diverse groups, and that it should inform constraints that produce disparities in access to and utilization of resources that support parenting across these different groups. We also recommended that this applied research should include the formation of a collaborative improvement and innovation network to develop new and adapt existing interventions for diverse groups. So let's see, next slide, please. With that, though, we'd like to conclude the presentation of the report, and as Kimberly mentioned, you know, this is a very brief overview with the focus on recommendations, and you really should dig into the report for everything that's behind these recommendations, of which is much about what we do know. So we don't want to end leaving the impression that we don't know anything about parenting and supporting parents of young children. We know a lot, And so in one of those domains, the committee identified common elements of effective interventions for supporting parents of young children. And those included viewing parents as equal partners in determining the types of services that would most benefit them and their children. So there are many interventions focused on a variety of different domains of parenting and different ways of supporting parents that take a parents as partners approach, that emphasize joint decision making. And we found in general, well, we're not speaking to all interventions, but in general, this was a characteristic of successful interventions with parents. It was also the case that many successful interventions are tailored to meet specific needs of families. So families come with diverse strengths and needs, and interventions that tailor appear to be more likely to be successful than those that don't. It's also the case that effective interventions integrate services and collaborate to support families with multiple service needs. So with many agencies and groups offering support to families, those interventions that were able to integrate those many services and effectively encourage and develop collaborations across them was also a common element in effective interventions. Effective interventions were also likely to create opportunities for parents to receive support from peers, to increase engagement, reduce stigma, and increase sense of connection to other parents with similar circumstances. So peer networks also were a common element. Effective interventions also were likely to address trauma, which affects a high percentage of individuals in some communities and can interfere with parenting and healthy child development. So this is within the report's findings, that element of effective interventions. You'll find the empirical knowledge just on the implications of when trauma is not addressed, and the trickling effects that it has on whether interventions can or can't be effective. Additionally, effective interventions, was identified that programs that are culturally relevant to improve program effectiveness and participation across diverse families, this was an element that was common to effective interventions, as well as enhancing efforts to involve fathers who are underrepresented in the parenting research. So with that, we can conclude the presentation of the report. This on the last slide is the link to the actual report. And as Kim mentioned, there is much in the report that we did not cover, that we don't have the time to cover, but I highly recommend taking a look at that, as it is, we're quite proud of how comprehensive it is in terms of the state-of-the-art knowledge and the information behind these recommendations, which justifies them providing quite comprehensive rationale. But with that, we have some questions that were given to us prior to the webinar, and I think what I'll do is play the role of moderator and open it up with a question for Kim. To provide a summary of best practices to change parenting behavior, evidence-based or research supported. So, Kim, could you, what does the committee learn in that regard?
Yeah, Eric, I actually wanted to go back to the slide that you presented on elements of effective interventions and just talk a little bit about the kind of, not exactly a conflict, but just sort of the tension between what we presented in the report about the intervention by intervention summary that's in there in what I described as the universal interventions or widely used interventions, which get at things like maternal and early childhood home visiting. And again, those are in there described, those are from systematic reviews or what's from the What Works Clearinghouse, the things that describe the school-based parent engagement. And again, they might be engagement in math, they might be engagement in literacy programs that are sort of layered on top of the usual school curriculum. For example, And again, you can go to these systematic reviews, you can see things like the effect size, and those are again summarized in the committee reports. You can see things in the various clearinghouses, and again, some of them have been nominated, self-nominated by the developers of these interventions and curricula, and are summarized again in the committee's report. So what the committee did was, in that chapter on elements of effective interventions, is try to sift through those one by one summaries of the different findings from the clearinghouses, from meta-analyses and so on, and what the findings were of those interventions, and sort of abstract from those and say, what are the kinds of elements of these effective interventions that we might have learned at this point? And those are largely described in that chapter and what Eric presented here for us today. But it really is a question in the field, I think. When a policymaker, when a state, when individuals, when the federal government or even a political candidate is trying to say, here is what I take from the evidence, here's what we take, and or incentivizing, as the Obama administration did, to say, here's a set of things that we think states should consider funding. The money from the ACA, the Affordable Care Act, for example, states were to pick from a list originally from the home visiting, because these met the evidence bar, according to the Department of Health and Human Services. A particular list met that bar to change parenting behavior in certain ways. The question is, are we, the committee said this is the kind of thing that had evidence, but then we went a step further and said these are the kinds of elements that seem to be effective over a broad sweep of kinds of programs, whether they were home visiting, whether they were education-based, whether they were PEDS, and so on. So that's what you'll see in the report as you dive into it. You'll see a very micro look at the things like nurse-family partnership, things like math interventions that engage parents, things like pediatric-based interventions, all the way to things like parental leave around the birth of a child. So to answer that question, there are two kinds of things that the committee has in the report, both the one by one interventions and these kinds of abstractions from those to the elements of effective interventions. How about Eric or Natasha, anything more to add in regard to that response?
Go ahead, Natasha.
No, thanks, Eric. No, that's great. I think you nailed it. I think the only thing to add that I would add is that, trying to, for example, home visiting programs are now trying to include the fathers as well. And I think that might be a new cultural way of doing interventions, where in the past, we have assumed that fathers are not interested, or they may be hard to get, or not involved, or whatever. But now we're learning, even from folks who are doing home interventions, home visiting programs with moms, that dads are often around and waiting, hey, and asking, like, how about me? Don't you want to talk to me too? Can I participate? So I think, adding the fathers and making these interventions a little more realistic for families, in which, even when families where the father doesn't live there but is highly involved with the child, I think will make the effectiveness of the interventions a little more ecologically valid for children.
Yeah, yes, and I think you stated it very well, Kimberly, that there's a large section of the report is in fact dedicated to identifying these best practices. And just to link to a couple other questions we have, we have some questions about what are the best practices for children who are involved in families who are involved with the state, for example, in foster care. We have some other questions about specific learning domains, for example, math and science. We have some other questions about parental engagement with schools. And there are evidence bases that we've covered, as Kimberly described, in each of these areas within the report. And in fact, a large section of the report is really dedicated to, as Kimberly described, by topic and also by intervention, walking through that. So excellent answer, Kim. I thought that was perfect. So here's one for Natasha. We have a question asking about, is there evidence that we can link to improving the parenting practices for parents who didn't necessarily grow up with a good role model themselves as a parent?
Yeah, so that's a really great question. You know, this intergenerational parenting, how do we learn to be parents, and how much does our past experiences with our own parents shape the parents that we are today? I think we don't have a clear idea from research. This may be another area where we may want to spend a little more time figuring out, but there have been some, at least basic science studies looking at how are the things that you learn from your own parents, or if you didn't have a good role model, how they influence your parenting practices. And I think we can turn a little bit to mindful research, reflective parenting, you know, parents who are encouraged. There's an intervention in Israel with Israeli families teaching moms, and I think it's just moms, to reflect upon their experiences in the way they feel about their children and about their own behavior in a way that makes that behavior more prominent and able to be scrutinized and changed. The findings suggest modest effects, but the idea that you are thinking through how your past experiences may have shaped either, you know, the way you punish your child, the way you interact with your child, I think it's very important, and something that maybe intervention, especially around parents who have trauma, may be well to take on. For example, in some studies that I've seen, including some of my own, we find that parents say to us, I was never close to my mom or my dad. I don't know what it's like to be loving to my child. How do you know, I'm supposed to say I love you, but I don't know how. I think, you know, attachment issues with your own parents are real issues that we have not attended to, but I think we should, and we're beginning to. So how do you do that? I think this mindful parenting might be a way to address these issues. Another way might be the context of the parenting now. We have, there are a couple of studies that show that fathers who say that they have been rejected by their own parents tend to parent better. And by that I mean they engage in less punitive behavior when they have supportive partners. When the partner is saying, you need to take a break, hitting is not, you know, it's not the way to do it, that those partners on those fathers tend to be less punitive. So there are some important aspects of the context in which parents parent that might make a difference in the parents' you know, lack of role models. But that also brings another question that interventions that are addressed, that could or should address both parents need to deal with, and that is you need to deal now with the risk that both parents bring to the table to address their parenting behavior. So, and you could argue that a child who has both mom and dad with high risky behavior might need different type of interventions than a child who only has one parent with risky behaviors. So those are issues that need to be addressed, but I think we can, and we should definitely move in that direction.
Great, thanks, Natasha. So I have another one for you, Kim. You know, some of the recommendations deal with the workforce, and so we have a question asking whether the report provides recommendations for higher ed coursework or field experience opportunities in the area of parenting.
Yes. So one of the things, as we talked about before, in the effective elements of effective interventions chapter is the workforce that Eric had spoken about before. And you know, as we mentioned, even though Eric and Natasha and I are mostly developmentalists, we had a great representation from colleagues in medicine and in the area of trauma and substance abuse prevention and so on, child welfare. So it was fabulous to learn from them and to hear about issues in other workforces too. So there are some great recommendations in there and some observations about other types of professional schools, and in addition to into early ed programs as well. So one of the recommendations in the chapter on effective elements of effective interventions includes some observations about training in health and human services providers. And for example, one of the points in there is that of the 250 graduate schools of social work, there really aren't courses for clinical students about things like evidence-based programming, for example, and how decision-making can be made in those areas around parent programs and what those are. So again, things like basic coursework in what the evidence-based databases are, how decisions can be made in choosing among those for families that have these kinds of needs. That was brought up, that's brought up in the report. Same thing for administrators in education. Think folks are getting that kind of training as well in the components that make up evidence-based practices, and that's brought home in that chapter also. And what it means to implement with fidelity, what low dose and low intensity treatment is, what those issues are. I also wanted to mention in response to this question that Marcy Whitebook and her team at Berkeley has done reviews state by state, and not every state, but states that have paid for it, organizations that have paid for it, of the early childhood education offerings across whole states and post-secondary to look at the variation in training programs, what courses are offered, what the redundancy looks like, what the kind of paths are. And I've said this before, that often, for example, most folks don't enter an early childhood program saying, oh, I want to be a home visitor someday, right? They often enter as teachers and then specialize later on. So this question of what exactly we are offering in higher education and coursework, and what it means to build an effective workforce is incredibly important. So I would also again refer folks to the resources and tools that have been developed from the National Academy of Sciences, particular report on the workforce, and again, as we're thinking about bringing together that report with this report on parenting and also the report on dual language learners, which recently is about to come out in its book form, it's in draft form now. I think folks are really trying to think across these three reports and how the workforce recommendations in those reports could line up. So that's an excellent question, and those are some of the responses that you can find in our report.
Excellent, thank you, Kim. So I just wanted, I'm going to mention, one of the questions that we have was whether or not the committee took on the task of considering policies that might be not directly targeting parenting interventions, but may have direct or indirect implications for families and for parents. And this was something that the committee certainly struggled over in terms of how far and how wide should we cast the net. But one of the specific examples given in the question was is family paid medical leave. And so family leave is in fact one of the policy questions that in terms of literature review is tackled in the report. And so the short answer here is that yes and no. We certainly could not cover all policies that may be relevant for children and young children and their parents, but some of the big questions that are being faced internationally and in the U.S. In terms of supporting children and families, we do address in the literature reviews. We have just a few minutes left, and so I'll open this up to both Natasha and Kim. And in asking, we did the committee provided a presentation to these the funders of this, or those who called for the report, and so the federal agencies as well as the foundations. And but there's the question of, beyond that, what happens next with the report, and what does the future hold for this report, and what use is it? Kim or Natasha?
Oh, Kim, go ahead. I will chime in.
Yeah, one of the dissemination venues that Yoma Ruka invited me to attend with her last July that I thought was very exciting was the National Conference of State Legislators. And there was a work group there funded by Heising Simons that I hadn't been aware of. It was a group that focuses, state legislators who focus on, have a particular interest on early education. And that's something I don't think that I had known about before that I now know from the SRCD communications and policy group that again, we are also excited about as SRCD, thinking about placing fellows, for example, at the state level, like states are really where a lot is going on, right? And when we think about dissemination of this report, that's exciting to me. So the idea of targeting these recommendations at the state and local level and how we've done that here, I mean, that's where we want things to, that's where things happen, right? So the idea of getting these recommendations into those hands is important to me. I don't know that, and when we think of things that, for example, Kimberly Boller is doing now at the NAS, where she is actually trying to implement these on the state level and having states raise their hand, having pots of money that can go ahead and try some of these things out. That to me is very exciting. So I actually haven't heard exactly of what Kimber might be up to with regard to this, but I'd like to know more about that. So if folks keep that in the back of their mind as something that, this kind of thing needs an impetus at that level. So those who are on the phone, who possibly could make those things happen, are making those things happen. I think, we've heard a little bit about that, but I think as a committee, those are the things that make this come alive, and I think we're particularly interested in that.
Yeah, just to chime into that, that's a very good point. The other thing that I want to really emphasize is that this report is not just for policymakers and practitioners, although of course it's for them, but also for the research community. This, for example, will be an amazing resource for graduate students or looking for research topics of dissertations, or for young scholars, or for anyone looking for a really good understanding of the science behind CAPS and how that information has been used to design interventions for a specific group. So I think, it's exactly right. I mean, as Kim said, targeting the report, disseminating to specific audiences who may have different interests, it's a great idea. And also, the report came out a couple, last year, I think, a couple months ago. And so it's been out for a while, but I think continuing to use it as a blueprint, as a resource that can be used by many, many types of audiences might be the best way to take advantage of this report in many ways.
Great, thank you so much. I'll just mention that, in fact, for those of us who are concerned with parents and parenting, that it is encouraging, in fact, that thus far the report has been downloaded over 12,000 times, and you can go to the National Academies website and see the countries, so not just in the U.S., but really around the world. It has gathered attention, and that is encouraging that people care about the evidence and care about this report and thinking about moving forward with supporting parents of young children. And so I think we'll conclude with that encouraging news, and we'll thank again the attendees and my co-presenters, and for our hosts and organizers for this opportunity to talk about the report. So thank you all very much.
Thank you all.
Thank you again to everyone who joined us today. Especially thank you so much to our speakers for this wonderful presentation. If you liked today's webinar, you may be interested in future consortium webinars. The next consortium webinar will be next Thursday, May 4th, and the topic is Excellence for All Children, Addressing Issues of Equity in Culture and Teaching. Please see the information on this slide if you would like to attend this webinar. Join the consortium listserv to receive notifications about future webinars, a quarterly newsletter, as well as other job and event announcements. I'll be sending a follow-up email to all who registered for this webinar as well as to the consortium listserv later today that will include a copy of today's slides and a link to today's webinar, which was recorded and will be posted on SRCD's YouTube channel. I'd just like to put one final plug out there to go check out the full report. I know we had some questions we didn't get to answer today, and I posted several resources in the chat box that are related to the full report, as well as a link where you can download the full report. And just encourage everyone to go take a look at that if you have outstanding questions after this webinar. And just thank you again to everyone for joining us, and have a wonderful rest of your day.